Guaifenesin is used to treat coughs and congestion caused by the common cold, bronchitis, and other breathing illnesses. This product is usually not used for ongoing cough from smoking or long-term breathing problems unless directed by your doctor. Guaifenesin is an expectorant. It works by thinning and loosening mucus in the airways, clearing congestion, and making breathing easier. Cough and cold products have not been shown to be safe or effective in children younger than 6 years. Do not use this product to treat cold symptoms in children younger than 6 years unless specifically directed by the doctor. Some products are not recommended for use in children younger than 12 years. These products do not cure or shorten the length of the common cold. To decrease the risk for side effects, carefully follow all dosage directions. Ask the doctor or pharmacist about other ways to relieve cough and cold symptoms. When taking G-Fenesin, it's important to follow your doctor's instructions. You can take it with or without food, usually every 4 hours. If you're self-treating, make sure to follow the directions on the product package. If you have any questions, consult your doctor or pharmacist. G-Fenesin may have a bitter taste, so do not split the tablets unless instructed to do so. Swallow the whole or split tablet without crushing or chewing. If you are using the liquid form, be sure to measure the dose carefully using a special measuring device/spoon. Do not use a household spoon as it may not provide the correct dose. For powder packets, empty the entire contents onto your tongue and swallow. To avoid a bitter taste, do not chew. The dosage will depend on your age, medical condition, and how you respond to the treatment. Do not take more than 6 doses in a day, and do not increase your dose or take it more often than directed. It's important to drink plenty of fluids while taking G-Fenesin. This will help to break up mucus and clear congestion. If your cough is accompanied by a persistent headache, fever, severe sore throat, rash, or if it lasts, returns, or gets worse after 7 days, be sure to contact your doctor. These symptoms may indicate a more serious medical issue, and you should seek medical help right away if you think you may have a serious problem. If you experience nausea or vomiting while taking G-Fenesin, it's important to inform your doctor or pharmacist. It's rare to have a serious allergic reaction to this medication, but if you notice symptoms such as a rash, swelling, severe dizziness, or trouble breathing, seek medical help immediately. Remember that your doctor has prescribed this medication because they have judged that the benefit to you is greater than the risk of potential side effects. Many people using G-Fenesin do not experience serious side effects. Keep in mind that this is not a complete list of possible side effects, so if you notice any other effects, make sure to contact your doctor or pharmacist. If you have concerns about the side effects, it's always best to consult a healthcare professional for guidance. Before taking G-Fenesin, make sure to inform your doctor or pharmacist about any allergies you may have. This medication may contain inactive ingredients that can cause allergic reactions or other problems, so it's important to talk to your pharmacist for more details. If you have a history of breathing problems such as emphysema, chronic bronchitis, asthma, or smoker's cough, or if you have a cough with blood or large amounts of mucus, be sure to inform your doctor or pharmacist about your medical history before using this medication. Liquid forms of G-Fenesin may contain sugar and/or alcohol, so if you have diabetes, liver disease, or any other condition that requires you to limit or avoid these substances in your diet, it's important to use caution. You should ask your doctor or pharmacist about using this product safely. Additionally, the liquid forms and powder packets of G-Fenesin may contain aspartame. If you have phenylketonuria, PKU, or any other condition that requires you to restrict your intake of aspartame or phenylalanine, be sure to consult your doctor or pharmacist about using this product safely. Before undergoing surgery, be sure to inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, you should only use G-Fenesin when clearly needed, and it's important to discuss the risks and benefits with your doctor. It is currently unknown whether Guaifenesin, the active ingredient in G-Fenesin, passes into breast milk, so it's essential to consult your doctor before breastfeeding. When taking G-Fenesin, it's important to be aware of potential drug interactions that could affect how your medications work or increase your risk for serious side effects. It's always a good idea to keep a list of all the products you use, including prescription/non-prescription drugs and herbal products, and share this list with your doctor and pharmacist. Guaifenesin is available in both prescription and non-prescription products, so it's important to check the labels of all your medications to ensure you are not taking more than one product containing guaifenesin. Additionally, it's important to note that this medication may interfere with certain lab tests, such as urine levels of certain acids, which could potentially cause false test results. It's important to make sure that lab personnel and all your doctors are aware that you use this drug. As for the optimal usage of G-Fenesin, the daily dosage and timing of when to take it will depend on your specific condition and the product you are using. It's always best to follow the instructions given by your doctor or pharmacist. If someone has taken too much G-Fenesin and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek emergency medical help by calling 911 or contacting a poison control center immediately. In the U.S., residents can call their local poison control center at 1-800-222-1222, and in Canada, residents can call a provincial poison control center. It's important to act quickly in these situations to ensure the person gets the necessary medical attention. If your doctor has prescribed G-Fenesin, it is important that you do not share this medication with others. It is also important to keep all medical and lab appointments. G-Fenesin is intended for temporary use only. Do not take this medication for more than 7 days unless your doctor specifically instructs you to do so. If your condition lasts longer than 7 days, it is important to inform your doctor. If you happen to forget to take a dose of G-Fenesin, just take it as soon as you remember. But if it's almost time for your next dose, then just skip the missed dose and take the next one at your regular time. Don't take double the dose to make up for the missed one. When it comes to storing G-Fenesin, it's important to keep it at room temperature and away from light and moisture. Make sure not to store it in the bathroom and avoid freezing the liquid forms. Different brands of G-Fenesin may have different storage requirements, so it's best to check the product package for instructions or ask your pharmacist for guidance. It's crucial to keep all medications out of reach of children and pets. When it comes to disposing of G-Fenesin, do not flush it down the toilet or pour it into a drain unless specifically instructed to do so. Instead, properly discard the product when it's expired or no longer needed. It's recommended to consult your pharmacist or local waste disposal company for the best way to do this. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.